Is nursing right for you? I have the quiz right now. I'm just going to ask you 10 questions and it will make clear if nursing is right for you. There are 3 people that are going to take this quiz. There are nursing students that are going to take this quiz. There are registered nurses that are going to take this quiz. Or you may be somebody who always wanted to be a nurse. You know all of the answers to this quiz. And this quiz right now will just let you know, yes, I should be a nurse. These are things that every nurse knows, every nurse needs to know. And so I want to know, do you know it? Is nursing right for you? As always, this quiz will come from my Quick Facts for NCLEX book. And this book helps you to pass the NCLEX exam, which is the test that every nurse has to take. If you want to live this amazing nursing life, you have to pass NCLEX. You can't give a medication until you do. You cannot work as a practical nurse or a registered nurse without passing the NCLEX. So let me show you how in my program, but I'm about to get into this quiz. Share this video if you know someone who you think should be a nurse and just see if they know this information. Question number 1 is this. Here's the first question. This is nursing right for you? Is nursing right for you? Question number 1 is this. What is the best diet for acute renal failure? What is the best diet for somebody with acute renal failure? If you know it, put it on the screen. You got about 5 seconds to put it down. I'm going to tell you what that answer is. Guess what? You can find it on page 4. It is acute renal failure, low protein. Yes, low protein, high carbohydrates. Low protein, high carbohydrates. Question number 2 is this. What type of anemia requires vitamin B12 injections? What type of anemia requires vitamin B12 injections? Are you living this nursing life? Are you living this nursing life? These are general questions that after you have gone through nursing school, you know the answers to. This is nursing. This is what we do here. Yes, somebody put it on the screen. It is pernicious anemia. Absolutely. You can find that on page 6 of Quick Facts if you have the book. Let's go. Let's go. Question number 3. What is the recommended blood pressure? What is the recommended blood pressure? All right, this is how we do at ReMar, all about nursing, all the time, all for you. Yes, you deserve to be a nurse. You want it. It's your dream. I got the motivation for you right here, right here. What is the recommended blood pressure? And if you have this book, you know that that answer is found on page number 12, 120/80. That's what we're going for. That's the goal. All right, I'm moving on. Question number 4. How many people have 3 out of 3? This is question number 4. What organ produces insulin? What organ produces insulin? Is nursing right for you? What organ produces insulin? Don't you just love anatomy? Anatomy is such a huge component of what we do as nurses that these basics you got to just take hold of. The organ that produces insulin, I'll tell you where it's found. It is found on page 24. That is the pancreas. That is the pancreas. Amazing job. Amazing job. Question number 5. I need a 5 out of 5. Here's question number 5. When you are drawing up mixed insulins, which one do you draw up first? Are you going to draw up regular insulin or intermediate? Do you know? When you have to draw up mixed insulins, which one do you draw up first? Is it going to be regular insulin or intermediate? Man, this is some good stuff. And I'm going to be shocked at how many non-nursing people out there know the answer to these questions. When you are drawing up mixed insulins, you got it. We always draw up the regular insulin first. A little thing we know in nursing school is called clear before what? Somebody finish that. Write that on the screen for me. But we always draw up the clear first. Next question. This is question number 6. What does the G stand for in nasal? Oh, No, I almost said it. What does the G stand for in the NG tube? If your patient has NG tube, what does the G stand for? Yeah, what does the G stand for? Oh, and let me go back to the next question. You can read about mixing insulins, whether you draw up the regular or intermediate, on page 72 of this book. 72, okay? The answer was regular. I see it on the screen. All right. Okay, so I just asked the next question was, what does the G stand for when we're talking about an NG tube? Yes. And think about the function. Nursing students out there, you have to know these things. You have to know what we use them for. You have to know when do we take them out. So the G is going to stand for gastric, nasogastric tube. And so the nasogastric tube runs from the nose all the way down to the stomach. Very, very common treatment for many types of conditions. And if you're a new nurse and you're working on a med-surg floor, I promise you, you will see a nasogastric tube in your first year. NG, nasogastric. Okay, and that's on page 76 of the Quick Facts book. Yes, love it. All right, number seven. We only have 10 questions to determine whether you should be a nurse or not. Tonight, question number 7 is, what type of medication is a tetracycline? What type of medication is a tetracycline? It is a long word. Most medications are absolutely long, right? They have long names. They sound foreign because we're not using them all the time. But tetracycline is quite common, and it is a very important type of medication. Do we know what type of medication is a tetracycline? Shout out to all the ReMar nurses on right now answering these questions. Whether you're studying or you have passed NCLEX with me, I am happy to have you here answering these questions. You never get too old for a pop quiz. And so tonight we're proving that. Yes, antibiotic, a tetracycline is a very powerful antibiotic. You can read about it on page 84 of Quick Facts for NCLEX. I'm moving on. The next question, this is question number 8. Is depression an acute or chronic condition? Is depression an acute or chronic condition? Clinically, what would we expect? How would we classify somebody who was depressed? Is it something that is going to be acute? It's going to come and go, right? Or is it a chronic condition where somebody might be dealing with it for a while, might be dealing with it? What would you guys say? If you are a practicing nurse, what would you say? If you're a nursing student, what would you say? If you're a nurse enthusiast, you're just interested in all things nursing, we welcome you here as well. The correct answer is we would expect depression to be a chronic condition where somebody would be struggling with it for a while, and or if they were able to deal with it, if they discontinued their treatment or they experienced some trauma, right? They may be able to regress. What's the word I'm looking for? Help me. Where you go back into it, right? But I do like the answer. It could be both, right? But clinically, we see depression as a chronic condition, okay? All right, number nine. Oh, and you can read about that on page 98 of Quick Facts. All right, number 9, what do platelets do? What is the function of platelets? And remember, platelets are found where? So you have to think about where you find platelets and then think about what they do, okay? Platelets are found in they're found in a body fluid. What is that body fluid? They're found in the blood, yes. And so they're a type of cell, right? You have red blood cells. What are the 3 types of cells? Okay. Let me just ask that. That's a side question because it is important to know what platelets do. But you have 3 types of cells. There are red blood cells, white blood cells, and platelets. Yes, so if anybody asked you that question, I just gave you the answer. So platelets, we know that platelets do what? And I see people already putting it down. Great job, Kimberly. Platelets clot the blood. So that is the function of the platelet. And you have to think about it. What are some conditions that we would give platelets for? If a patient comes in and you see the doctor on the orders say transfuse platelets, then we know that the patient needs help with their blood clotting, or we call it coagulation if we want to be fancy. Okay. All right. Good job. All right. Final question. Is nursing right for you? This question is this: what do the letters PO stand for? What do the letters PO stand for? This quiz is to just it's a pop quiz. It's a pop quiz. And so it's general things that every nurse should know. And even, if you don't think nursing is right for you, if you know this information, then guess what? You have a heart, you have a capacity for nursing. PO means what? It means by mouth. It means by mouth. And I got this all from the Quick Facts for NCLEX. In the back of this book is a pharmacology section. So, pow, pharmacology, everything every nursing student should know. And these are the things that will be on our board exams. So again, this book is super helpful. If you don't have it and you need to get it, it's really easy to get. You can go to my website where I keep all of my really good nursing information. It's ReMarNurse.com. ReMarNurse.com. And you can pick up your Quick Facts for NCLEX. Now, every Monday I go live and we do just this. We talk about nursing. We prepare for our board exams. We motivate each other. We encourage each other. Like tonight, I had nurses come on and they say, "Hey, Regina, I passed NCLEX. Thank you so much." Or they say, "Hey, Regina, I just started my nursing job." Or they say, "Hey, Regina, I ordered, where's my book?" Right? All types of nurse enthusiasts come here. But I love to leave you with motivation. And so here's my motivation thought for you. If you're watching this right now and you desire, you have a heart, you're excited about a future in nursing, let me tell you this. And congratulations for you guys who got an 8 out of 10, a 9 out of 10, a 10 out of 10. If you got those type of numbers on that exam, you have a wonderful foundation for nursing. You are going to be a great nurse because you've learned a lot of information. So here's my motivation. This year is flying by. How many people really feel like time is just flying by? I know I certainly do. And what I wanted to tell you tonight is that you literally have 4 months. You have literally like 4 months until 2022. That's it. That is all that is left in this year. So knowing that, what are you going to do with 4 months left? Are you going to let it continue to go by until you wake up and realize it's 2022? A whole year has gone by. Or are you going to spend the next 4 months busting your tail in order to get your 2021 goals accomplished? Because at the beginning of the year, I am almost certain that you had a place in your mind that you wanted to be by the next year. You had some things that you wanted to get done by 2022. And so what I'm telling you right now is that you have 4 months to get those things done, or they won't happen in this year. A whole year will have gone by and you would not have done what you said you wanted to do. That is very, very sobering. That is very, very, essentially you can have 4 months of results, or you can have 4 months of excuses. Which one is it going to be? Put it on the screen. Are you going to have 4 months of results or 4 months of excuses? Because that is where we are in time. That is where we are in time. So if you have not heard anything else that I have said today, and I've said some good stuff, remember this: time is running out. Okay? you have just a few months left before this entire year is up. There are things that you need to accomplish. And so this week, this is Monday. This is your Monday motivation. This week will set the tone for the rest of the year. What are you going to do? What are some things you need to do tomorrow? Okay. What are some things you need to do tomorrow? What are some things you need to do tonight? For some of y'all, the first thing you need to do is go to the website and get quick facts for NCLEX because you don't have this book. For some of y'all, the first thing you need to do is take this book and open it up. Put a marker in it like I do, right? Say, I need to have these amount of pages studied by, I need to study 10 pages this week of this book because I want to pass. For some of y'all, you need to schedule your exam. You need to schedule your NCLEX exam. That is where we are in the timeline. Some of you guys have tests coming up this week, and you need to do your final checks of where you are. Some of y'all need to send an email and say, Regina, I don't know where to even begin. I don't even know where to begin. That's somebody watching this right now. All right. Some of y'all need to be like, hey, I'm in nursing school and I need some help in nursing school. All right. Wherever you are, this video has something for you. Okay. So this is the week that you figure out what your plan is. Okay. What your plan is very simple. Become a nurse. That's the plan. That's option A. You don't have an option B. There is no fallback. The people who fail is because they think they have a plan B. All right. Let me tell you this. Your plan is to be a nurse or be a nurse. There's no plan B. Okay. Because anything other than that, you're cheating yourself. And life is too short for that. Don't cheat yourself out of an amazing life because of an excuse. All right. So, yes. And I want you guys to keep this energy because you may not have seen it like that. You may not have seen, oh my goodness, we really do have 4 months left. It slipped by you, right? You're ready for Thanksgiving. You're ready for Christmas, right? But no, this is the end of the year. This is the fourth quarter of the game. This is the fourth quarter of the game. Are you getting in or are you sitting on the sidelines? I need everybody on the field playing, okay? So whatever you need to do this week, it gets done. Reach out to me if you don't know, okay? My email is support@remarreview.com. Support@remarreview.com. The first step is the hardest. The first step is the hardest. So if you can take that first step, then the others will come a little bit easier, a little bit easier, a little bit easier, a little bit easier. All right? Okay? So that's it. That's the motivation. That's the plan. You did the questions, right? You have fun. You have fun doing the questions and testing yourself and challenging yourself, right? Right? That's all fun. But then the hard work is what sacrifices are going to come until you get that license. What do you have to give up? What do you have to do? Okay. So I want you to reach out to me. If you don't have a plan, let me help you. If you already have my products, don't neglect the work. Okay. That's it. Okay. That's it. Make sure also that you are being kind to yourself during this process. All right. And don't be afraid to tell people no. Okay. Look around and say, okay, what have I been filling my time with? What are some things that are distracting me? Is it social media? Are you on TikTok for hours? Are you on Instagram for hours? Put that time into something that's going to profit you, okay? Like studying, even if it's just temporarily, okay? And so all these things can be considered, but you are the master of your own destiny. Nobody's going to give it to me. Nobody's going to give it to me. I need you guys to say that. Nobody's going to hand me my nursing license. I have to earn it. You have to earn those letters behind your name. And you can do it. I've been helping nursing students pass for over 10 years, the NCLEX exam. And I believe that you can do it as well. There's nothing stopping you but you. So get out of your own way. Get out the way. Move around and do what you need to do. Okay? All right, guys. I will see you later. Remember, I always say this. You can, you will, you must pass NCLEX. Get this book, guys.